I'm sure you know that the rural areas of this state are quite underserved relative to health care, and Hawaii Island is most especially underserved with not enough physicians and inadequate hospital capability to serve our 185,000 residents. So is there a federal role in addressing this situation? And if so, what can you bring as far as resources to address the issue? 1 minute, please, and please, Senator Schatz.
This is one of the toughest parts about living on the neighbor islands, and you all know it better than I do. I just get told about it. You all live this issue. I can tell you that we're fighting as hard as we can to make sure your rural hospitals and your low-volume hospitals get the resources that it needs. I have one full-time person and one half-time person, and their mission in life in my office is to make sure that we maximize federal funds for our local hospitals, because this is tough. When people get sick, if they need something interventional, a lot of times you have to be medevac to Honolulu. A lot of times, if you have a chronic situation, whether it's cancer or something else where you need radiation or other kinds of treatment, sometimes you have to fly to Oahu, and that is just absolutely untenable. We were able to get some money for Kona Community Hospital, North Hawaii Community Hospital, and $400,000 for critical access rural hospitals. It's not enough, but I want you to know that I understand how big of a deal this is, and I'm working on it.
Thank you. Ms. Hanabusa.
Thank you, and I'd like to acknowledge Dr. Ruth Matsuura, and as many of you know, her son Peter fluctuates between being the only orthopedic on this island, and maybe he gets some other help. But I know a lot about this issue because Dr. Ruth is my mama in Hilo, and I stay with her and have my own room. But what you all need to understand is that the problem is really having physicians. And what we can do federally is we can explore issues such as forgiveness of debt. As many of you know, many of the Native Hawaiian physicians have been offered different kinds of programs to serve the underserved areas as well. But it's coming down to an issue of quality of life for many of our young physicians. So there needs to be more than just the fact that we're giving things like tuition waivers or considering it. We have to address how do we entice them to serve the rural areas.
The second health care question, which is 1 minute, Ms. Hanabusa, has to do with Medicare reimbursements for our doctors. And Dean Jairus Hedges of the John A. Burns School of Medicine has mentioned that our state reimbursement rates are set artificially low. I think we might be the second lowest. But doctors now tell us that Medicare reimbursements for doctors on this island are the lowest of any in the state. But this is a federal issue. So 1 minute, what are you specifically going to do to address that issue?
The one thing we have to do is we have to bite the bullet on the sustainable growth rate, which is called the SGR. That's what sets the rate of reimbursement for doctors. And every year, it was supposed to be amended, it was supposed to be repealed, and we haven't had really, I think, the guts to do it, and we need to do it. We need to bring stability to the issue. We cannot have doctors facing that every time to know whether or not the SGR is going to be repealed or not. The whole issue of service to Medicare has to go to the fact that we cannot, and Congress has done this, we cannot cut Medicare to providers. And that was the reason why I could not support the Bipartisan Budget Control Act, because in it, it cut 2% more for an additional 2 years to Medicare providers, and that cannot continue to happen. We need to preserve Medicare. We need to enhance Medicare.
Thank you so much. Mr. Schatz.
We did pass the so-called DOC fix, which is the Sustainable Growth Rate bill, but the problem is we've been doing it year by year on a sort of piecemeal basis, and it creates a lot of anxiety in the healthcare community, and especially among doctors who take Medicare. And the difficulty right now with the, as you say, the artificially low reimbursement rates is that even those doctors who want to take Medicare clients and patients have a very difficult time making ends meet and making the math work. And so one of the things we have to do is a permanent DOC fix. The other thing that we're working on is subsidies for the low-volume hospitals that have a smaller number of Medicare recipients. These are issues that are very, very tough to work on, but we're going to continue to do so.
Thank you very much.